Canine Longevity is presented by Myos Pet, the leaders in pet muscle health.
When we talk about longevity, one of the components is being proactive versus reactive. And that means we really need to understand what's going on within your dog, within your patient that we're dealing with as veterinarians. And there's so much that can be going on regarding inflammation that we're just not even aware of. It's the same with us in humans. And it's all about data, right? Data is king. And for us to actually be able to have ways to analyze what's going on inside the dog's body proactively, and a more proactive versus reactive response or rate is going to be really important. So this is really taken off in the human realm, and believe it or not, it's in the veterinary space as well. So on today's edition of Canine Longevity, we have Dr. Morrow here from VDI. He's going to be talking to us about all things related to the ability for us to test these types of changes, inflammatory changes, mediators, and so forth, in our patients. Dr. Morrow, thank you so much for joining us.
You're welcome. Thanks for having me.
So another veterinarian, we're going to geek out on all sorts of things. And close by in Pennsylvania, it sounds like. What led you down this path? So a veterinarian that's now going the path of all the holistic longevity, wellness. Was there anything that with your own pet or patient, or what was it that kind of steered you in this direction?
So I started very early into integrative medicine and studied actually at this very conference it was not called NAVC. It was the Eastern States Veterinary Conference. I met Dr. Carvel Tiekert, who was the founder of the AHVMA, the Holistic Veterinary Medical Association, and I specifically attended this conference so I could get more understanding of acupuncture and TCVM. And I thank my lucky stars that I met Dr. Tiekert, and he had been the president of the Maryland Veterinary Medical Association. So he had approached me and asked me how I liked the conference and if I'd like to be a member. And that opened up a whole world of information. I originally joined the organization just to have access to their newsletter or journal. At that time, it was more of a newsletter. Now it's a peer-reviewed journal of the AHVMA, and you can get lots of data about integrative vet medicine, and it's a great resource. So I started down the path looking at how we could do better for patients than just focusing on vaccines and, like you mentioned, reactive care. And that led me towards getting certified in many modalities in alternative and integrative vet medicine. But early on, even in 1987, when I started my practice, I wanted to have diagnostics available at point of care. And that was tough to find. So I had a wet chemistry lab. In 87, I did emergency care, and that was really unheard of in Western Pennsylvania at that time. There was no emergency clinic in Pittsburgh. And I found it to be very helpful in diagnosing early rather than waiting days to a week for blood work to come back. And then I just built on that. But in I think it was 2009, I started using VDI laboratories, and I found them to be very helpful, and especially because I could get C-reactive protein testing, some early cancer diagnosis, or at least leading me onto a path where I could say to the pet parent, listen, this thymidine kinase, the C-reactive protein's elevated. I'd like to do an abdominal ultrasound, and it's so much easier to get clients to be compliant and interested in exploring more possibilities when you have data to show them and say, this isn't just my intuition. This is a piece of paper that says we should do an ultrasound.
Right. So how did you discover VDI? So were you searching for labs that would do these types of alternative type panels, or you just stumbled across them? Or
I think I started doing vitamin D testing first, and I was really interested in vitamin D and the way it helps support the musculoskeletal system, the immune system, the kidney functions, all of those. So I started there, and then I think I added in the lymphoma screening panels next, and And I was extremely impressed when Randy Ringgold, the owner of the company, called me one night after, I think it was after 9 p.m., and he had figured out by, I guess, my contacts that I would work late into the evening. So, and he called me and he said, "Tell me about this patient." And I thought, good golly, I've never had anybody do that. And I had used smaller laboratories than what we have now available for my diagnostics. And I mean, sometimes I'd have to chase down the clinical pathologist, and I think most veterinarians have experienced that when you say, this blood work doesn't match what I was seeing. I want to talk to somebody. And then it's layers of talking to people. And Randy was always available, and if he wasn't immediately available, I'd get a call back within 24 hours. And I quickly learned that having C-reactive protein, now many people are doing CRPs, and of course feline haptoglobin, was just such a gift to my clients and my patients to be able to respond very proactively rather than wait until we go down the road of serious disease.
Right.
Canine Longevity is presented by Myos Pet, the leaders in pet muscle health.
Dog's age, muscle loss can quietly steal mobility and quality of life. But what if science could help change that? Myos Muscle Formula with Fortitropin is an all-natural, science-backed ingredient shown to help build and maintain muscle while reducing muscle breakdown, with over a decade of research and real results. Because stronger muscles means more moments together. Myos, more time together.
So then you were using the lab, and all of a sudden now, fast forward, you're working with them. How did that come about?
I'm not sure. So maybe 5 or 6 years ago, I was, and I will say that VDI Labs has been very, and Randy and Kyle have been very supportive of the AHVMA, and it's been a really nice symbiotic relationship for members with VDI who are AHVMA and members, and certainly other people are using their lab services. But I stopped by the table at the AHVMA conference, and maybe it's a little longer ago than I recall. I'm sorry. This is 38 years in practice. So we were talking about vitamin D, and Randy mentioned about how magnesium, if you can't get those vitamin D levels to come up, magnesium is really important to follow up on. And they were starting to do serum magnesium levels. So I said, well, I already use magnesium, and I use a lot of topical magnesium in my practice. And I kind of figured that out along the way. And then Randy had asked if I wanted to be involved in submitting some samples. And we did that, and he recognized that I was sort of researching a lot of human side and European studies in nutrition and longevity medicine on both the human level and the veterinary level. And we would sometimes talk and collaborate. And then he had asked me to be on their medical advisory board. And then this past year, he asked if I'd be interested in being the medical director. So
you're doing that and practicing still?
Yes.
Wow.
Yeah.
Wow.
Well, it's at this point, we say it's around 4 hours a month, but I think it's more than that. But I love it because I love how innovative VDI is and how responsive they are to the veterinarian's needs and interest and curiosity.
So how are you getting the word out? So I think the challenge we have in the veterinary industry is that this whole area of proactive medicine, right, versus reactive. I think the challenge we have of even understanding when and why they should run these tests, and then what the tests mean when they get the results back. We're going to geek out on biochemistry here in a bit, but it's a matter of they're so busy. Veterinarians are seeing the cases, they're trying to work them up, do their annuals, do the vaccines, get them out the door, and to do that deep dive into, hey, this is more of a proactive type test I want to run. Even in the healthy dogs, I think obviously that's what we're talking about is here being proactive. How are you getting the word out to veterinarians that this exists and the why? Why is it important?
So First, I'll speak as an individual practicing veterinarian. When I see cases, and I see cases from all over, as many integrative veterinarians do, I'm usually in contact with a local veterinarian. And so even if I don't directly speak with them, when I send the pet parents, and I always send pet parents with their data so they can have it and keep it in their own folder as well as in the chart I possess. When they go back to their veterinarian and I suggest that they have these tests run, I have many clients who spend half the year in Florida and half in Pittsburgh. They then the pet parents are educating their veterinarians.
Right.
And sometimes it shocks me that a veterinarian has been given a gift and they choose not to open it up. And most veterinarians, though, will ask the pet parent how they can, contact this laboratory, or they'll contact me directly.
Okay.
So I've done some podcasts for CIVT, and I did get veterinarians contacting me
Good.
after that podcast. And it wasn't specifically about VDI, but some of the things that I mentioned led to veterinarians saying, hey, I want to find out what they offer. And the service is just exemplary from VDI, and that's why
You're part of the part.
Yes, yeah.
So if a client or a pet parent orders the kit, they have it run, and they have questions, can they call directly into you as one of the veterinarians to ask questions, or are they directed back to their veterinarian to answer questions regarding the results?
So at this stage, at the level that I'm involved, I am not answering other veterinarians' questions directly.
Okay.
I will collaborate with Randy Ringgold, and sometimes he will send me an email that has the ordering veterinarian's information. So it's usually Randy communicating with the veterinarian.
Okay.
And most of the time I give him a bigger answer about the case and it goes beyond the scope of the diagnostics and my clinical impressions. And then he'll share that with the veterinarian who ordered the test. We're really not consulting at this stage not at all direct to pet parent, other than values. But what VDI does, and they do well, is that it's a test and treat philosophy as an integrated veterinary lab. So that means when the test results are presented, then options for next steps are given.
Perfect.
Which is great.
To the pet parent and to the veterinarian, or
veterinarian.
The veterinarian.
So then the veterinarian, as an example, let's say the TK test and C-reactive protein, or in cats, the haptoglobin, are elevated on an advanced gastrointestinal panel. Well, there'll be these little boxes that explain each of the values, such as the TK is elevated, C-reactive protein is normal.
Right.
Investigate for pancreatitis. Well, CPL, FPL are on that AGI panel.
Got it.
So we can already rule in, rule out pancreatitis. And then there may be a line, and I started with elevated C-reactive protein and TK, elevated neoplasia index, do diagnostic imaging to see, do you have lymphoma going on here? So it gives a lot of guidance. Vitamin B12 is on that panel for AGI. And if vitamin B12 is low, there'll be guidance on dosing for vitamin B12, not just give them some B12, but like sometimes as veterinarians, we're in the dark about, okay, vitamin D is low, what do I do now?
So if that's the case, where do you send them to get the supplement? So is there a particular, or they just go online and sort of look at it, or do you guys help with that as well?
We help with that as well.
Okay.
So VDI now keeps in stock many of the supplements. So it simplifies ordering. Yes, it's really very nice.
Okay.
So it simplifies. So the veterinarian can just call them directly and say, send me a pack, a dozen of these, or I only have one patient who needs it. Can you send that out with my next kits or whatever supplies they need?
So I'm going to play pet parent.
Okay.
And so I'm listening to this podcast, and I say, whoa, I have a 5-year-old lab. I want to have this screened. I'm going to be more proactive. So they're going to, and say their veterinarian that they see, hasn't worked with you guys, hasn't worked with it, and doesn't really know a lot about some of this proactive medicine. Can the pet parent, can I, as the pet parent, reach out to you, order the kit, you send it to me, and I take it to my veterinarian? Or would I say, hey, I'm really interested in this. I have to convince my veterinarian to order the kit from you guys? Help me with that first, because I have me as a pet parent being very proactive. Man, I'm all in. What's my next step?
If someone asked me directly what to do, my response would be to contact the veterinarian.
Their personal veterinarian.
Their personal veterinarian.
Okay.
And it's so easy to set up an account. VDI makes it very simple.
Okay.
Unlike some of the major labs, you can order 3 tests a year. You're not committed with any crazy contracts or fees. And the really nice thing is that Randy will do in-service kinds of live Zoom meetings with staff to explain the applications of each of the tests. People can get started with one test. You're not obligated in any way. So I think it works well for the pet parent, in this case you, to go to your veterinarian and say, hey, I heard this, it's great. And these folks say, you can just go online, VDI.com,
Order the
I
kit.
think, and order the kit or talk to them. And Kyle and Randy will get on the line and they will fill a veterinarian in, send whatever kits they want, and you can start slow.
Perfect. So kit's going to come to my veterinarian, take my dog in, they're going to draw the blood, send it in. Results then come to myself and the veterinarian, or will they go to my veterinarian?
The veterinarian for review, which is good, because if something is unforeseen or doesn't make sense, then
they can reach out to
VDI labs.
Okay, perfect. And then,
but the report, I will say, their reports are beautiful.
Okay.
The report is
Can the
really
client,
easy
can I as a pet parent get a copy of the report as well? Because I love to keep all my files and, kind of
I
about
give
that.
all my
Okay,
clients.
so we can have a copy of that.
You can have a copy, and the copy is very easily understood by the client.
Okay.
This segment of Canine Longevity is brought to you by Equiseer for Dogs, combining light therapy, infrared, and neurostimulation to help support canine comfort and movement.
Now, my veterinarian, inventory, right? They don't keep all the medications, all the supplements on the shelf because they have such limited space, right? So you guys carry the supplements. So if it shows my pet is, deficient in X, Y, and Z, now I can go directly back to you and say, hey, I'm deficient in these, or my pet is, and I can order these supplements, and you'll drop ship them directly to me, or do I have to pick them up through my veterinarian?
Yes.
Because I'm just trying to figure out logistics, because as we really get the word on the street out there to proactive medicine, medicine 3.0 versus 2.0 in the veterinary space, I think what's going to happen by demand, the veterinarians are going to be brought into this, right? Because so many of them aren't quite there yet. We're really pushing for it, but it's going to be by client demand. So what you're going to find is that, especially as things like these podcasts and TV series release, you're going to like, whoa, lots of dog owners are reaching out. How do we actually make this streamline, and how do we make this so that we can scale this up? So I know that my clientele, boy, oh boy, a lot of them are performance dogs. They want things like yesterday. They're a little impatient. And they're like the border collies that they're running with. And so definitely something that I want to be able to say to my clients, hey, this is the next steps as you're going back to your veterinarian. So is very, very helpful. And the supplements, then we'll talk to Kyle about how those actually then get back to the patients. And I'm assuming then once they're on those supplements for a while, they should probably rerun the panels to make sure that we're balancing out, right?
And the profiles say, for instance, with vitamin D, because it's a fat-soluble vitamin, you're not going to run it the next week.
Right.
Run it in 8 to 10 weeks.
Right.
Now, I have some clients who are in my office 3 weeks after, we drew the test, and then we review. I send them with the vitamin D. I stock it in my office. And I will often have 2 or 3 supplements. Of course, we don't start all these supplements the same day. You have a pet parent calling you the next day saying, what did you do?
Yeah.
So then I'll tell them from that date that they start the supplement, and we schedule the follow-up blood work before they leave the office.
How often do you see vitamin D being low in the patients you screen?
So this is an interesting question because previously I saw it about 65 to 75% of
Whoa.
the time. But now something has happened since COVID, and I have not talked to Randy about this in detail. I am seeing more elevated vitamin D levels and very elevated vitamin D levels. So this is my theory. I always ask clients about what else they're giving that I don't know about. And lo and behold, my clients are sent a survey every time they're having an appointment, which says what new things are going on, what old things haven't resolved, what food and supplements are you giving? And I will get a whole list. And invariably, I get a list of what I recommended, either from TCVM herbs and general supplements. And I look at it and I say, okay, that matches my notes. Here we go. We're in the room. And I get these crazy 250 vitamin D levels. And I'm like,
Wow.
this is odd. This dog's not on any supplemental vitamin D. When I asked the client, and now I've been specifically asking about therapeutic mushrooms because as therapeutic mushrooms are all over the internet, I'm seeing loads of elevated vitamin D levels.
Okay.
So now it's becoming important to monitor, are we excessively supplementing? The other thing that will raise vitamin D, and you know this, is all the salmon. And there's loads of salmon meals, salmon treats, dehydrated salmon. So now we have to worry about that. But this is the other part. I have a theory that many pet food companies, to make up for the rising cost of muscle meat going up, are adding more organ meat.
Okay.
And it's really easy to do, even in raw foods, and maybe more so. And I have many clients who are feeding raw or
So that's even more important because in the sporting dog community, the agility community, that is a very hot topic and hot area that they will commonly do. So boy, we need to stay on top of that.
And I think pet parents really need to be watching vitamin D levels because you get excessive for a long period of time and then you can have damage.
Dr. Mara, it's been incredible. Thank you so much for taking time with us. And if pet parents would like to learn more about your company, they go to
vdilabs.com.
Excellent. Thank you so much.
Thank you.
And remember, it's all about your pet's health span, not just lifespan. And stay tuned. Coming up with us from VDI, we're going to have Kyle here to talk about all things bioenzymes, biomarkers. We're going to geek out. Stay tuned. Stay.
Canine Longevity is presented by Myos Pet, the leaders in pet muscle health.
So joining me now with Canine Longevity is Kyle Wilson with VDI, and we're going to be talking about all things biomarkers, inflammation, test kits, everything we should be doing from a standpoint of longevity and proactive medicine with our canine patients and pets. So thank you for joining us.
Yeah, thanks for having me.
So I'm going to geek out a little bit. I was a biochemistry major at Hopkins, and so I know your whole area of understanding these things is a deep dive. So if I get too deep, be like Canapp, rein it back in. So when we talk about this proactive medicine, when you go to your veterinarian, they run your basic CBC chem profiles. They do it for us as well when we go to our own doctors. And there's such a deeper dive we should do, even with us when we're looking at a lipid panel, and there's LP little a and all these things that you go to your general doctor and they're like, you want to run what? And so I think what we're doing now is we're seeing owners being way more receptive to a proactive approach. And therefore, I think we'll have a trickle-down effect to really bring small animal practitioners into this whole world of testing that you guys are doing through VDI. So explain to me, help me understand a little bit what's available as far as to the pet parents out there. What tests should they be doing? How often should they be running them? Are there kits, and are those kits sent to the vet or to the owner? So kind of a little bit, I guess we'll first start with what do you recommend on like an annual basis or semi-annual that people really should be adding to their basic workups just for your healthy wellness evaluations?
Yeah, so I'm going to touch on one thing you just mentioned there is about the CBC chem profile. It's a conversation we have with veterinarians, even pet parents every now and then, which is the body works really hard to keep blood chemistries normal. And so it's not until things are really outside of normal before there's actually problems. And a lot of times, even when something's abnormal, it's well, let's wait and see and test again. That's not being proactive, that's being reactive. So that's why we're working on building out more biomarkers, more tests, more options to be more proactive at detecting disease earlier so you can get ahead of it and start taking action. We kind of lump them into two kind of main categories. One is inflammatory diseases and things like detecting inflammation. Apparently, healthy animals should not have inflammation.
Right.
So that's where C-reactive protein and haptoglobin come in as early indicators of inflammation. Then we also bundle in things like nutrition. So nutrition is a very critical point. Obviously, there's all the talk on the town all the time is good diet leads to good health. Problem is diet is only as good as the individual and what they're actually getting from their diet. So testing can help us determine, are they getting all the nutrients they need? Essential vitamins, vitamin D, B12, folate, magnesium, but even things like hair analysis looking at micronutrients. So it's kind of a whole look of what individual pet is getting. And it could be siblings in the same household, two golden retrievers from the same litter, on the same diet, same age, everything, same health status, different vitamin levels.
Right.
So nutritionally, we say start around 1 year old. Once you're on the adult diet and you've kind of got a good stable diet, get that first test in. See what the levels are, see where you need to make some tweaks or adjustment, or maybe it's just not a good diet for that pet. Start again, find another one that they're tolerant to, and try to make good progress and get a good healthy diet that's got the nutrients that they need. Then as you start progressing, getting into the adult age, you start screening for inflammation. That's going to be C-reactive protein, haptoglobin, looking for just general systemic inflammation and see if we can take steps to control it or mitigate it or find the source. And then once you start approaching senior age is when you get into the more specialty things. That's going to be hyaluronic acid, which is a joint test, looking for early signs of degenerative joint disease. Cancer screening, looking for early signatures that cancer may be growing, or that the pet's at risk of developing cancer. That's a big thing, is like it may not have cancer now, but we're starting to see abnormal cell growth. We're starting to see inflammation. And when those things happen together, it's a recipe for cancer growth. So especially when you couple that with low vitamin D levels, that kind of thing, you really want to try to bundle that together. So we start to say if you're a high risk breed, or if you're starting to get into the senior age or the late adult stage, that's when you want to start looking at those specialty kind of tests. And then that's kind of the framework that you build off of the specialty test. There are some other applications, like if you're a sporting dog, for example, you're an agility dog, you may want to do some of this stuff earlier, try to make sure you stay on top of it.
Canine Longevity is presented by Myos Pet, the leaders in pet muscle health.
Dog's age, muscle loss can quietly steal mobility and quality of life. But what if science could help change that? Myos Muscle Formula with Fortitropin is an all-natural science-backed ingredient shown to help build and maintain muscle while reducing muscle breakdown, with over a decade of research and real results. Because stronger muscles means more moments together. Myos, more time together.
Well, I think having a baseline. Data is king. So I think everybody, when they go in as a young dog, they have the wellness evaluations, they have the panels run, and that way they have a starting point. And they can track those over the years to see. And I think you mentioned the senior dogs with cancer screening, but would you think to do cancer screening even earlier, as because some of the cancers we see in golden retrievers may see even
absolutely.
earlier.
High risk breeds, as soon as they're adults, it's a good time to start. Yeah, okay. And you're going to get that information. What we're really looking for in the cancer screening isn't, are we detecting cancer? That's a very big important piece.
Sure.
But when we do cancer screening, we bundle it with inflammation. Right. And inflammation is that propagator of disease, of all diseases, including cancer. And so if we can take steps even before the tumor develops, then we can start to push that down the line, or hopefully prevent it altogether.
Got it.
So if you start testing sooner, that's when you're going to start seeing these trends pop up. When you see trends pop up, you can take action.
Right. So what about GI? This term loosely, GI mapping, or looking at the gut is such an important organ, so responsible for cardiovascular disease, type 2 diabetes, cognitive dysfunction in humans if they have inflammation within their guts. Is there anything that we can do for the patients as well to look at any kind of gut health that you have?
Yeah, there's some definitely microbiome testing that's a good option. Mapping the biome, seeing what kind of bacteria, the diversity, the richness, seeing if there's anything growing in like an SIBO situation. Sure. We also have some other stuff that we work on. We look at things like mycotoxin exposure. So this is mold growth that could be from the areas they live, especially in hot, humid conditions. Sure. That can be an underlying contributor to GI and derm signs. Glyphosate exposure, Roundup. huge pesticide used all over the world in food sources and chemical lawn treatment. That can lead to leaky gut, which is, obviously a contributor to GI signs. So there's some other preventative or underlying diseases that you can look at using testing as a resource to see if the pet's exposed to it.
So how do you decide? You have so many tests that you can run. Is it based on, we have a pet parent that says, man, I'm all in, and my clientele will be like, check, check, check. They'll have to check every single box. And so how do you determine based on age, breed, like when a pet parent's going to reach out to you directly?
Yeah.
How do they decide which kits to order? Or I know they should always go through their veterinarian, but I can tell you so many times my clients are going to be ones that are going to be like, I just want it all. So how do you decide? How do you determine that?
So the first step, and Dr. Morrow alluded to this, is we try to empower the veterinarian. They are the one seeing every animal. They're the one on the front line. So to the extent that we can empower them and educate them, that's what we try to do as a company. But a lot of clients need that help, and we provide it. So we provide some general framework based off of age, what kind of dog, what kind of cat, what's their lifestyle,
Sure.
that we make some recommendations on when and what kind of testing to choose, and we put them in panels. And that's where our baseline recommendations go. Now, nothing stops you from going to the top tier and getting it all and getting the information. It's a great place to start, usually the best value versus doing
Right.
it, piece by piece as you go. But we provide that guidance, and there's a few selective panels and groupings that we recommend based on lifestyle or life stage.
So let's say my class, so I do sports medicine, so I see a lot of the agility dogs. And so let's say that I have an agility dog client. We're saying I am the agility dog owner, and I'm listening to this podcast or this TV series. I'm like, okay, I'm one of those. I'm going to check the boxes and all the kits. What are the kits? And so it sounds like they can get these kits directly from you. Give me a little bit of information as to what the different kits are, and then how will they get the samples? It sounds like you have one that's fur. I think there's one that's definitely you take to the vet's office to have a blood draw. What are all the kits that they would be ordering, and what's the steps to get the results?
Okay, so there's two basic kit types. There's serum, which is going to require blood draw from the veterinarian.
Okay.
Any panel that's selected that has serum, we'll bundle it so that the pet parent gets the kit, schedules a blood draw with their vet, takes it in, and the vet just finishes processing. They don't have to worry about any payment with the lab. They don't have to worry about any of that.
Okay.
The pet parent will get a copy of the results, and the veterinarian will get a copy of the results. That way everybody's in the loop and they can have discussions. Things that may not need serum, so fur test, pet parent can just collect it according to the instructions and send it right to the lab.
Perfect.
We send them a copy of the report, and if they so choose, we'll send their vet a copy of the report. And then the same is true with our urine tests. They'll be the same. They can be collected at home. If you're having trouble collecting at home, you can request that from the vet, and they can help with that.
Of Canine Longevity is brought to you by Equicere for Dogs, combining light therapy, infrared, and neurostimulation to help support canine comfort and movement.
So I'm the pet parent. I did the fur test.
Yes.
And you sent me the results directly. Now I'm going to go right to your website. And do you have a patient portal or a place that I'll go to compare my results to normals? Or do I get a nice list of normals and abnormals and some thoughts or recommendations based on my return results from you guys?
Yes, so we do normal ranges with all of our testing, or sufficient ranges in case of like vitamin D. So we do provide that on the report. Then we make recommendations for products where it's suggested and necessary. Everything we make on a report is in consultation with your regular vet. So we don't want anything to be stood in isolation. It's part of a collaborative team effort to make sure the pet's getting the best care. So keeping that in mind, we do provide recommendations on the report that the veterinarian can review with the pet parent, or the pet parent can look at it, and if it makes sense, and after they've already talked with their vet, they can move forward with looking at those products. So we partner with a range of companies. We don't manufacture our own products, so we find partners that are high quality, reputable, with good products that we know are safe and effective. And we make them available. So if they're on our report as a recommendation, you don't have to follow the recommendation, but it's there as a resource to say, this is a good product that pairs well with the results of your specific pet.
Perfect.
And then you can go right to our website and you can order it. Now, some things may be only through the veterinarian. So we do have some veterinarian only products, and it'll ask you to have your vet contact us to order, because they are vet only products. But a lot of it, like vitamin D, B12, colostrum, that kind of stuff is available to the pet parent. So just right there, easy to order, even from different brands. It's just if it's on our report, it's on our website and you can
Got it.
order it.
Perfect. What are the ones that you'd have to get through a veterinarian?
We have a couple lines of like nutraceuticals that are veterinarian only lines.
Okay.
Some of the more advanced treatment protocols may be veterinarian only, but for the most part, it's all publicly available.
Perfect. And how often do you recommend that people run these tests? What's the typical panel that you recommend, the all-in, the first sample, and how often should they be repeating that?
The all-in is at least twice a year.
Twice a year. Okay.
That's kind of the gold standard. Now, there's an opportunity to test more frequently depending on what the results are. And we provide guidance on that. So if vitamin D comes back low and it's the only thing, maybe only a vitamin D is the only thing you need to repeat.
Okay.
8 to 10 weeks, we make that recommendation of when to do that. If something more significant is out, like a cancer risk assessment or a GI panel, something is a little more critical, the test window would be recommended, and it'll vary depending on case by case. But we make those recommendations. But for general wellness screening, you're looking at least twice a year if you really want to stay ahead of the game.
Right.
Some of these diseases, especially cancer, can develop really quickly. Things like hemangiosarcoma, for example, can just show up out of nowhere. And so you want to make sure you're getting that data quickly enough that you don't miss the window where your opportunity for best outcomes is.
Okay. So cost, if a client's looking at this twice a year, pet parents looking at this twice a year, ranges of prices for the different kits, what do they cost?
Well, they can range anywhere from $110 for vitamin D to like a $500 all in. Everything's kind of their panel. So
But for my client, that's the border collie owner that checked
wants
every single
everything.
box, that's about $500.
about 500
Okay.
roughly, give or take, and that's going to include a lot of information, a lot of data, a lot of it that you can take proactive steps and help for that long-term health.
My clients like a lot of data.
Data, we're great at data, and that's one thing our company really strives for, is not just presenting data. You know, the standard lab report is, here's numbers on a page, figure out what it means.
Right.
We take those extra steps to try to understand what they mean in context with the patient.
Awesome.
One thing you'll see us talk about a lot is context sensitive. Everything we do is context sensitive.
Okay.
So when you submit a sample to our lab, we ask a bunch of checkbox questions. What kind of medications? Is there recent surgery? Other concurrent diseases? Is there a tumor? What kind of GI signs? All of that drives our expert system, so we can dial in those recommendations, so we can dial in that diagnostic and say, this is what's going on specific to your pet. And that really helps us provide a better service than just, CRP's abnormal, good luck.
Sure. Okay.
So,
Makes sense. It's been fantastic.
yeah.
So if pet parents listen to this right now and they're interested in more information or ordering the kits, how do they do that?
They just head to our website, vdilab.com, and that's all the information's out there. They can definitely reach out to us anytime. We're very responsive. There's not very many layers of people to go through to get to somebody, usually myself or Randy, and we'll get you responses. Definitely, if they can get their veterinarian involved as a partner in this, it makes life easy, because they're going to have additional questions, because unfortunately life's not as simple as just one test result, right? So we're always here for that. So just head to vdilab.com and shoot us an email, give us a call, fill out a form.
Perfect.
And we can help.
Kyle, can't thank you enough for taking the time.
Yeah.
Really much, just great information. This has been Dr. Sherman Canapp with Canine Longevity. And remember, it's about your patient or pet's health span, not just lifespan.
Good girl, Fachi.
Canine Longevity is presented by Myos Pet, the leaders in pet muscle health.